Welcome to PWS United, a podcast for the Prader-Willi syndrome community, brought to you by PWSA USA. This podcast gives the latest news in research, advocacy, and family support by bringing together staff, volunteers, PWS treatment specialists, biotech and pharmaceutical representatives, caregivers, family members, and individuals with PWS. Our goal is to share education, awareness, and resources with those living with PWS and their supporters. Join us in our mission to enhance the quality of life and empower those affected by Prader-Willi syndrome.
Hey everyone, just a brief introduction here before we get into our Ask Nurse Lynn episode about behavior and psychiatric issues. For those who aren't familiar, Lynn Garrick is our medical and research coordinator here at PWSA USA. She is a tremendous support for families, answering medical questions and connecting them with providers and specialists and important resources. She is also the driving force of our weekly Ask Nurse Lynn column, where families, caregivers, and individuals with PWS can write in with any non-emergency medical question. And there is your disclaimer. Non-emergency medical questions only, please. The submissions are checked once a week, and some take more response time. So if you have a medical emergency, certainly call 911, or if you're in another country, the medical alert hotline number where you live. If your situation is not a medical emergency, but requires faster response time, like your loved one is in the hospital and the doctors need specific PWS advice or information, you can always call our crisis hotline at 941-312-0400. We've had so many questions come in lately about behavior, psychiatric issues, medications, and things of that nature that we decided to spend a whole episode on this topic. So for this episode, that's what we're doing. Now there's some great information, advice, and anecdotes in this episode. But before we get into it, I do want to mention that the day this episode airs is the last day of National Nurses Week. So, of course, we want to send a shout out to all of the incredible nurses out there who work with our loved ones with PWS, and a special one to our favorite PWS advice nurse. Nurse Lynn, you have truly helped to enhance the quality of life of so many families and individuals living with PWS, and we are deeply grateful. Welcome back to another episode of PWS United. I'm here with my co-host, Carrie, and our favorite nurse, Nurse Lynn. She's going to come on here to talk about some of our submissions. So instead of just reading through all of the questions that people have submitted, I kind of pulled out some of the main ideas that people are interested in. So one of the things that comes up is about subtypes, because there are different subtypes to PWS. I think there's 3. Let's start with that. How many subtypes are there?
So yes, the most common one, and about probably 70%, I believe, is the paternal deletion subtype. Then there's the maternal uniparental disomy subtype. There is something called mosaicism, and there is also something called imprinting.
I don't think I've actually heard of mosaicism.
It's probably the least common, but it has to do with, think about every single cell in your body when you have Prader-Willi syndrome, be that your cells in your fingernails or your toenails. They are all affected. All the cells carry this Prader-Willi, right? But in mosaicism, it picks and chooses. There's maybe my fingernail doesn't have the PWS that isn't, affected by that. Or maybe there's some cells in my liver that isn't. But everything else I am probably not explaining that as a geneticist would, but that is my understanding. Yeah, my very oversimplified way of saying it, yeah.
I need oversimplified for sure.
Yes.
So with those subtypes, are any more susceptible to mental health issues, or how does that show up anyway? Anyhow?
So the uniparental disomy subtype studies have shown that those are the individuals that are more susceptible to psychosis.
Do you know, Lynn, off the top of your head, the percentage of how many individuals are affected or have that subtype?
I believe 25 to 30%. which doesn't stand with my 70% deletion. But it is the second most common type. Yeah.
Should parents be concerned? I just don't want a parent whose loved one has UPD. I don't necessarily want them to start panicking.
No, there's plenty of people that will never affect. There's plenty of all of the subtypes that, they're fine. They just have some of those, rigid thought processes, but necessarily can be managed by good environmental controls, and it will never reach the point of an actual diagnosis of obsessive compulsive or psychosis. I think what we need to focus on is a lot of the behavior in Prader-Willi syndrome isn't necessarily willful in their behaviors, but it's rooted in their brain differences. So, the hypothalamic dysfunction, and it's very neurologically driven. It's not, I am going to set out today to just cause havoc. And so that kind of shifts the approach from discipline to support and prevention in behaviors.
So, can you say more about that? So, it shifts it from discipline to support. I like that.
So and I'm going to kind of shout out to Jan Forrester and Linda Gurash, they have this thing called the PWS intervention pyramid. So when you think of a pyramid, right, at the very base of the pyramid is environmental interventions. So a lot of the behavioral interventions is we know, locking cupboards or creating these structures in place where what you're going to get meals, at these times you're going to get X amount of snacks throughout the day, and building in structure and support. And then kind of the other layer on top of that is trying to provide some coping strategies. So always building in some sort of flexibility. Hey, things might change today, but we will have lunch or whatever. And maybe when we're upset, we go to our room or do some mindfulness activities or deep breathe or, visualization, or we talk it out. We go for a walk, having some of those coping strategies in place and start those from a very, very early age. Always prevention and building foundational skills will help in behavior management. Some people build in some incentives, if we do this for 5 days, we'll do this, or, we'll have a small reward, a non-food reward. Let's put stickers on a chart when you're a child or whatever that may be. Coming up with behavior plans, whether you're working with a therapist or somebody else. And then the very top of the pyramid is, wow, I think I need medication help. I'm doing everything right. There is structure in place. There's consistency, meaning consistency in mom says the same thing. Dad says the same thing. Brothers and sisters say the same thing. Teachers say the same thing. First we'll do this, then we'll do this. That's very, very important for our individuals to have that consistency with messaging.
There's also, Lynn, services, right? Like somebody could have a BCBA come and do sessions with your loved one and kind of teach those training skills as well, or those coping skills.
Absolutely. And a lot of those services, you can start those either through your social worker, your provider has access to some of those. Maybe you're just Googling things online and then you can get, support in your own home or offsite. Some people my son used to have behavior therapists come into my home and do play therapy and things like that with him. We've been to center-based therapies also. So it's just kind of accessing those services however you can.
I actually had the unique opportunity to go and sit in on a behavior session with I think she was 6 at the time, year-old girl living with PWS. And it's such an amazing experience to witness that. Because again, I don't have a child with PWS. So to be able to kind of see that, how that plays out and how they're learning and watching it click. It was really amazing and wonderful to see that happening. And it was so sweet. And she clapped so much and she looked like she was having such a great time learning. And it was such a great experience.
Yeah. It's so great. And therapy can be such an amazing thing. And it's one thing to do it in that moment, but then to apply that when parents are tired at the end of the day. I just worked a 12-hour shift or whatever, or my husband, or maybe I'm a single parent. I'm out of town. I have other kids. My energy level and my attentiveness is not always at 100%. And that's difficult because as parents, personally, I feel like you really do have to be on 100%. You
Mhm.
know, say you're in Target with one of your other kids and they're having a meltdown. Fine, here, just take it and be quiet because I can't deal with this. But that really creates a pattern then of, oh, if I do this, then I will get this. I will get my needs met by having these
Mhm.
behaviors. And I think when we think about Prader-Willi syndrome, a lot of the behaviors commonly include something like anxiety and maybe that intolerance for uncertainty, perhaps, that cognitive rigidity. They're kind of very black and white. And, if I say the sky is blue, no, it's not. And you cannot get me to change my opinion. Some of that perseveration, too, is pretty
Mhm.
common. Asking the same thing over and over and over again, or asking the same thing, but maybe in different ways.
Uh-huh.
Like, "Oh, I am what time is it?" "Well, it's 11:30." "Yes, lunch is at noon." Or, "Hey, what,"
Right.
they ask the same question, but kind of in different ways sometimes. And some of those obsessive compulsive features, it's not true obsessive compulsive in most cases, but the collecting of things. My son, he collects candles or stationery or things like that. Like, it's never, never enough. And then, some skin picking and things like that, and the outbursts that we have of temper outbursts. So,
I have found with Freya that she asks a lot of questions about things, and I realize a lot of times it's that she wants to talk about it or that she's excited about it, but rather than knowing to say like, "Oh, I'm really excited for this," she'll say, "Where are we going this weekend?" Even though we've talked about it 20 times. And then other times I realize that she is very much an out loud thinker. And so I have had to learn how to kinda shut it off and, like, I don't always have to respond or listen, but it's very hard when, like, you talk about that overwhelm, you're tired, and sometimes I'm just and I'll say, "Freya, I need my headspace, like, I can't like, I'm so overwhelmed right now, there's so much in there already, and you're just putting more in there. I just need you to stop for just a second."
I have found that in a lot of individuals, they're very, like you said, you and I think about so many things all at once throughout the day. But I feel like some of our folks, they don't have that ability to keep it in their head. They just say it to say it. Just whatever pops in, they're saying it. And like you said, sometimes they just need to say it and they don't need a response. They're just saying. But it does take that discernment to figure out when they need a response, because sometimes they might just be talking to talk or to get things out, but other times they need a response, and if you don't know that, then you could set yourself up for
Right. Yeah, I
some
get, "Mama, are you
behavioral.
even listening to me?" I'm like, "I'm always listening, I'm just"
I'm always listening, yeah, and a lot of I think with the adults that I work with, sometimes just acknowledging, like, I might not be listening fully because I've got a lot of stuff going on, so please just, have some patience with me too, and just recognizing your own emotions and labeling them can also help them label their emotions, because I feel a lot of times they may lack the understanding or how to explain, "I'm feeling anxious." What does that even mean? "I'm excited." That probably comes out as anxiety. But,
Mhm.
if you say, "I'm really looking forward to going here this weekend. We're gonna have a lot of fun. I'm excited," and starting to label some of those feelings might help with some of the recognition skills for themselves. I've heard some people say, "Your body looks like it's telling me that you might be anxious because I noticed that, you're rubbing or you're doing some tells, if you will, when they're anxious. They're pacing or they're rocking or they're
Mhm.
bringing their hands," to sometimes label that too. Your body's telling me that you're anxious. Do
I
you
love
wanna talk
that.
about it?" Yeah. Yeah.
One of the tools they were using at school with Freya when she was having a lot more emotional dysregulation before pitolisant was a thermometer. It's this whole program or something, but it was like 5 different faces and you could adjust. But basically, it's like you teach them about it when they're not emotionally dysregulated and how like this face represents when you're feeling this and kind of describe how it may feel in the body, blah, blah, blah. So that when they are in that moment, the idea is that you can show them like, where are you on here? And then they've
Mhm.
already kind of determined, like, "When I'm up here, leave me alone," or whatever.
Yeah.
My sister does this often with her patients as an occupational therapist. It's the zones of regulation.
And a lot of times it's different colors, I believe, but she says it works so well. So, yeah, even if you just looked it up and online, they would give you an outline of what it is, and, she says it's super helpful to implement, so
I
sounds of
think
regulation.
there's so many different tools like that
There
to
are.
use,
Mhm.
and certainly you don't wanna, like, shove a piece of paper, "Where are you?" When they're
Right.
when they're having a that but, like, practicing those things when they're in a
Mhm.
calm state, and maybe it is, "I'm blue, I'm red,"
Yeah.
or something, then and then even more helpful is, "This is my child or the individual I support with Prader-Willi syndrome in their best days. They are laughing, they're engaging in reciprocal communication, they're having fun, they're calm." And then, like, stage 2, they're starting to pace. They're starting to rapid fire questions. Some people might, like, start saying the same thing over and over again. Zone 3 might be, I am now throwing things, whatever. I am acting out because I have lost it. But how in each of those phases, how do we get back to or remain at baseline in the best day? And so I think having that listed somewhere for school, for caregivers is also kind of helpful to review with people that might not be familiar with your kids. This is how a good day looks like. This is each stage of, and hopefully you can catch them so they never end up where they're, breaking things or hitting people or anything like that. But
Yeah.
you'd have to practice some of those things too. Ask what number are you? What color are you? Or whatever tool you're using. Yeah. But then
Yeah.
that helps build in those coping strategies too. At a stage 2, we could suggest, do you want some deep pressure? Should I give you a hand massage? Should we go for a walk? And
Mhm.
maybe get them back down. Yeah.
I love that.
A lot of good skills. I think in a lot of, especially our occupational therapy blog articles, Annie, and some of the stuff that we've been doing in April have different ways that you can introduce those kind of interventions, those tips just for at home, something simple. So we definitely have some resources on our website to find
Yeah.
ways to implement those and different ways to help. So,
I think one other thing that should be stated is that, in my experience, a lot of our kids, and this is not a professional term, they can read your energy, right? They know if you're having a bad day, they will just know. You could come in, hey, they'll know that you're having a bad day, and that might kind of set the stage for how they might be acting that day. So, always trying to check yourself first with every interaction. And then also, if they are acting out, having kind of that low expressed emotion is kind of the term that we use, which is hard.
Yeah.
Because sometimes if you're like, wow, what a stop, knock it up, they're going to just match that and maybe even intensify that. So,
Mhm.
as much as you can, try to remain calm. We're never 100%, but
I just had an experience yesterday. I'm in perimenopause and I had wanted to have like a teenage size tantrum. Like I was my whole body, I don't know, whatever hormonal rush I was having. And then we were trying to get chickens out of the yard and like it was just, and I was so just like on the verge of, I don't even know how I am going to regulate right now. Like I'm so dysregulated. And Freya just kept saying, "Are you mad at me? Are you mad at me? I'm sorry, mom. Are you mad at me?" And I'm like, "No, just get the chicken in the cage, you know?" Like, and then afterwards, she just was really like, "Are you okay, mama? Can I have a hug?" And I was like, "Yes." And
oh,
just like, we just sat there and hugged for a minute. And it was
yeah.
so like just what I needed. But yeah, she was very concerned about my
very
state.
in tune. Yeah.
Yeah.
They're in tune and they're always people pleasers. And I think a lot of our individuals, they internalize that. Are you mad at me?
Yes.
No,
Yes.
honey, I'm not. I'm mad at these stupid chickens that won't go into the cage. I'm not mad at you at all. Yeah. But important to label that too, knowing that they might be feeling that. I am not mad at you. I am mad at these chickens. So there's nothing to do with you. I love you. I'm mad at these chickens.
Yeah.
Yeah.
Yeah. So,
I have an example of, like, my son once, many years ago, we had a little behavior program at my house. Good week of behaviors. We're going to go to your favorite water park. Great. I'm like, go get in the car. Wait for me. I forgot my keys. Well, while I was trying to get my keys, the phone rings. Prung, so, of course, I answer it. what I failed to realize is that he's so excited about going. No, I didn't get my keys. I forgot something. Anyway, the keys. He put the keys in the ignition and drove through the garage door. Like, all of a sudden, I was on the phone inside the house in a matter of a minute. But bam! Right? I'm like, oh my God, what was that? Do. I run outside. He had driven through somehow. I don't know how he managed to put it all together, but drove through my garage. And I'm like, stay calm, stay calm. He got upset because he knew I would be upset, ran out into the middle of the street, stripped naked, and all was saying, "Are you mad at me? Can we still go? I still want to go. I earned it." So
Oh.
it was like, oh my God, what am I going to do? What am I going to do? Everything about me was screaming inside, what the heck is going on? What am I going to do? But if I didn't act calm when he was already stripped naked in the middle of the road, things really, really, really would have been a lot worse.
Yeah, oh, goodness.
It was still bad. But
Did you go to the water park?
we sure did
I
because
You
we
have
sure
to. There's
did.
no other
Yep.
no other solution.
Garage door can wait. Yeah. Uh-huh.
Yeah, remove
Yeah.
anything valuable out of the garage
Yep.
to
Yep.
the
Yep.
locked house and deal with it later.
But so many of our folks deal with varying levels of behavior, some very minor and some really extreme behaviors, which is very scary, very scary. Yeah. When you think of the eloping or like
Mm.
running away in the middle of the night, where you hear of these horror stories of people drowning or being abducted or, things like that. So many things can happen, or some of the more, aggressive behaviors when there's holes in the walls and there's broken windows, or I'm on the roof threatening to jump off, things like
Or
that. It
when
could be
other people in the area or vicinity think that there's a situation going on and they call law enforcement. I feel like I've
oh
heard
yeah,
those several
yep,
times. Yeah.
yeah.
Yeah, those
It's
are
good to,
scary.
kinda keep your neighbors in the loop if you're comfortable with that. "Hey, just know this. We're doing
Mhm.
our best. Please don't call unless I'm screaming at you to call. Call 911."
Right.
Yeah, yeah.
So are there certain ages or developmental stages that things like this are more likely? Like, is there something parents maybe should be more prepared for, like in puberty or
Definitely think, like, I don't know that there's peer-reviewed evidence on this, but, like, starting the age 9, 10-ish, and then kind of that puberty age too, certainly, there's a lot of developmental changes. Think about those ages of school transitions, body changes, hormonal changes, maybe realizing that I might be a little bit different from my peers, my siblings who are having their friends come over and spend the night. And maybe I don't have those outside friends, which might be another good plug to get them involved in activities from an early age to build that kind of community, like some of the other neurotypical children might have. Special Olympics is great.
all right, so you've got this pyramid. And
Yeah,
so
got the pyramid.
parents, caregivers have done everything on this pyramid. We're up to that top, to almost to the top tier. Everything's consistent. We've taught the therapies, blah, blah, blah. Are there signs to it's time to try medication?
Yeah, I absolutely think that, when all of these measures that are consistent in the structure and everything is going, we're doing the best we can. We're on point, but that anxiety is, or whatever that might be, aggression, none of this is working. There's still this is inhibiting them really from doing things that they would love to do, right? I can't move beyond my anxiety. I can't enjoy school or life or family because I'm just this ball of anxiety, or I'm flying off the handle and I'm starting to physically assault people and I can't be redirected. You might want to talk to a psychiatrist or get a referral and then start talking about medications and think about what is the main thing. Sometimes you really have to do a lot of investigative work, right? What is the main thing that you want to tackle? Because that can help the psychiatrist. If it's anxiety, then there's some medications for anxiety that we kind of commonly use. Or if it is severe aggression, we might target that with a different type of class of medication. And then always making sure that we start low and go slow. A lot of our kids, they metabolize things a lot differently, right? And so we need to make sure that we're starting at very low doses, especially with some of those SSRIs that are commonly used for anxiety, perseveration type stuff that can be mood activating, meaning you might see worsening. And that means that dose is probably a little too high for them. So things like that. But it's hard to find psychiatrists, and I know this because I hear it every day, that are familiar with Prader-Willi syndrome. It's difficult, I think, with people with Prader-Willi syndrome because it's very complicated. So working with somebody, and if not, reaching out to us at PWSA USA. We have a couple great psychiatrists that work specifically with people with Prader-Willi syndrome and have for years that will do consults with your provider. And they'll kind of work through some of these prescribing decisions with your provider into seeing what is the right medication or combination of medications that may work for your individual. There's no one magic pill, and that's the sad thing, you know? It sometimes is some trial and error, and that's not what we want as parents. As a parent going through it, I want just fix it. Just please. I just medicate and I'm fine. I'm a great, stable individual. It just doesn't happen that way. But I think it's just kind of going back to that pyramid and really thinking about, is everything in the environment secure? Is everything on point? Are my coping strategies in place? Am I working my therapy skills? And then always keeping track of those behaviors too is really great for providers. Hey, it's this time of day, or when this happens, is transitions, is the change. And then that might help inform the provider, oh, well, if it's just during transition time, then it's probably not a true medication that we need, right? It might be some other support strategies that we might need to work with. Behaviors are toughest problem aside from food.
I think too, in kind of this day and age and looking for towards the future, there's currently a treatment available, and there might be more coming out that are specifically for individuals with Prader-Willi syndrome. Not necessarily honing in directly on behavior, except the one clinical trial that's out there, which is amazing. But do you think that there will be like a different way that people, how do I want to ask this?
I think with the medications,
Introducing those,
yeah,
medications, will that help at all? Will there be any kind of different feelings among individuals if they're on these treatments? What could that future kind of look like, I guess?
I would think that the more and more therapies and treatments that we get, especially with, a lot of not a lot, the hyperphagia medications,
Mhm.
if you quiet that food noise and that anxiety around food, I do think you will see those behaviors lessen. I think that's just kind of a natural side effect of having some of that food anxiety, if you will, or focus
Yeah.
muted. I don't know that they will take them away, but it might mute that so-called drum, that's always beating. It might not be like a timpani drum, like ding, 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 right? It might just be ding, ding, ding. And that might raise the threshold, if you will, for your stress tolerance. So our folks, they always have this lower stress threshold anyway. You and I deal with, and they do too, a lot of stressors throughout the day, good, bad, otherwise. We can tolerate those and we manage this homeostasis, if you will, but they have a very low tolerance, I think, for a lot of those stressors. So I'm hopeful that some of these medications and new therapies will kind of raise that bar a little bit so they can handle that a little bit more and use those skills and call up those skills more readily
Mhm.
to adjust.
Yeah. And Annie, I don't want to put you on the spot. Since Freya's been on pitolisant, I know it's for excessive daytime sleepiness, but have
Mhm.
you noticed anything in addition, like around behavior possibly with it as well?
It I mean, it's been drastic, I would
Really?
say, and I know this because I've been trying to get her into the regional center, which is a whole other topic. Trying to get Freya back into the regional center, I'm having to go through and look at her past behavior plan and her SKIA, and this is all from before she started pitolisant. And I mean, it's just drastic, the
Mhm.
difference in behavior, and maybe some of that is due to age, some of it
Mhm.
was the triggers that have left the classroom, but yeah, just and I like how you explain it, Lynn, like, that makes sense, like, her tolerance is higher, like, her whereas before it was like, something little could, like, I felt like I was constantly on guard, listening, like, I could be in the other room, and I feel like I could just hear her energy shift, if I heard her sister talk to her in a certain way or whatever, I'd be like, "Oh god," just was, like, constantly kind of on edge, and I just don't I mean, she has PWS, like, that's not going away, like, that I'm still more hyper vigilant with her, but yeah, her tolerance for things is much higher, her emotional regulation is a lot mellower.
I think that's a great point. I mean, with more not focus on sleep, but more awareness of how sleep, especially in our individuals, play into behavior and every other aspect, that is so important. I mean, it makes sense, right? If I'm not getting enough sleep, I'm crabby. I'm not like I'm
Very irritable,
foggy.
yes. Same.
And so if you think about these folks that are chronically, not getting a good night's sleep or have any manner of disordered sleep, that definitely will lower that threshold even more.
Yeah.
Yeah, for tolerance. And I think a lot of people, myself included, would describe some of the behaviors 0 to I'm at 100 in a nanosecond. There's no in between. There's no gradual increase of,
Right.
it's bam. And so, like what you're describing with the medication that Freya's on, she's not 1 to 100 right away. She
Right.
might be 1 to 25, which
Yeah.
I can work with now.
Right.
Yes. Yeah.
We can still intervene with.
Yeah.
Uh, yeah, so I'm a huge fan of pitolisant, and
Yeah, it's a little plug too for just how
yeah,
important our clinical trials are.
and I
Oh my
think that,
gosh,
yeah,
yes.
there's just not the awareness so much about I mean, I didn't know. I mean, I was seriously like, we're doing this because, she had a play one week, for school. And so every night before her performance, I was waking her up from a 2-hour nap to give her a giant cup of coffee and being like kind of pushing her out the door. And, just like every day was like a 2-hour nap.
I think there is a more of an awareness, I'd like to think, or maybe just because 'cause I'm more aware, but I know I've shared this somewhere else. When John was younger, it was just, "Oh, that's Prader-Willi syndrome." They just all fall asleep in the car. They always need naps throughout the day. They're just, it's because of their hypotonia. It wasn't thought about or even mentioned or known at that time, disordered sleep. Think
Mhm.
about that. Think about excessive daytime sleepiness. And, very selfishly of me, I'm like, "Whew, he's taking a nap. All right, I got"
I know. Yes. Oh my
you
God.
know?
Yeah. I was a little worried. I was like, God, do I want to give up that like 2-hour break in the middle of the day?
I know,
Like,
I know. And that's natural, and I mean, we feel guilt about that, or at least I do. I'm like, "Oh,
yeah.
I should have recognized that. I should have done something about that, but that was my only time, or some of my only time to just have a minute." I don't know.
Yeah. That's
But
And that's
understandable.
what's so amazing about PWS, like the awareness factor that's been happening, especially in I would say the last like decade or so. It's amazing. All of these industry partners coming in and helping, spread the word, like Trent helping with
yes.
excessive daytime sleepiness and getting Harmony involved. And it's really that awareness effect is amazing. So I'm hoping that that continues and more things like behavior in itself are, addressed
Oh, absolutely, and I
and
think,
helped in the future more so. Yeah.
even how the awareness of sleep really highlights just how complex Prader-Willi syndrome is and
Mhm.
how all these things they intersect somehow. My behaviors, is it because of sleep? Is it because of environmental, is it TV ads, or all of these things have to be taken into consideration with behavior. And I think sometimes that's overwhelming when you're in the thick of it. I should maybe go back to like when you had a question, Annie, like when do I need to look at medication? When do I need to have support? And I think a few things like the sudden changes in behavior. Like suddenly you have never done this before, and now there's this new thing going on. Any more signs of like true depression or withdrawal? I'm just going to sit in my room. I just don't, I'm just going to sleep all day. I don't want to. Maybe that's school bullying. Maybe they're just having a more awareness of that they are different from their typical peers. Definitely if they're having hallucinations or paranoid thinking or any functional decline, meaning now I don't take a shower anymore, or I'm not bathing, or I forgot how to do this. Those are definitely things that require some sort of intervention. And we always think first, is there something medically, going on? Did they have a UTI? Do whatever, but then definitely too thinking about psychiatric diagnoses.
So at that moment, if a parent finds themselves at that moment, are there recommendations on how they find a psychiatrist, talk to a psychiatrist, or do you recommend calling PWSA to get that advice for the specific situation?
Well, I think you could always call PWSA USA because I believe we have a wealth of information and
Mhm.
history and people to call upon that are experts. But always do talk to your provider because those are for a lot of people, the gatekeepers to referrals to
Right.
other places or even knowledge of, I need a child psychiatrist in my area or an adult psychiatrist, which might be even harder to find for a lot of us. And obviously, if you're in a medical crisis, call 911.
Right. Yeah. I wonder if it's important to name some of the more common medications so that families maybe have a place to start if they do need to go to a psychiatrist, or is it just so random? Not random, but I mean,
Well, it's not random. I think, when we think about like peer reviewed medical research, right? I know of only one, and that's the Dr. Singh and his guanfacine, the guanfacine XR, which can help with some of the behaviors, some of the attention, some of that anxiety. But a lot of times, so like low dose SSRIs, we're thinking of like citalopram, Zoloft, Celexa, those types of things for some of the impulsive, maybe disruptive and aggressive things, guanfacine, we are looking at some of those things like Risperdal, sometimes
We had a couple
aripiprazole.
questions come in
Yeah.
about, I don't know if I'll pronounce this right, but risperidone.
Mm-hmm. Mm-hmm.
Is that right?
Yep, and so a lot of times that can be used for severe aggression, where
Mhm.
I am hitting, punching, scratching, breaking everything. Some psychotic symptoms that can be used for some mood instabilities. But again, every medication has side effects. So you
Mhm.
want to risk benefit that. Some of them are very sedative.
mm,
So you might want to, if you're giving that, you might want to give that at night instead of in the morning. Some of those types of things. Some medications can have side effect of weight gain too. So you need to look at that and really talk to the provider to see what would be the best option for your individual.
Yeah, there's several listed among the questions that we've received, like, again, I might butcher this,
Mhm,
clozapine?
mhm. A good medication, but something that requires frequent lab work too, because it
Mhm.
affects a lot of stuff
mm,
in your body. And so sometimes that's used for kind of it's a good medication, sometimes used for maybe a last ditch kind of effort, like, "I need this." I
And
don't
that's what they
know that.
said in the question, doctors wanna use it as a last resource. That was what was
Yeah,
stated, so
it's frequent lab draws and stuff like that, which some people love and some people do not.
Oh, got you.
Might be very triggering. Sometimes if I'm having a full-on behavioral crisis or I'm not well regulated, getting me out the door and safely into a car, then transporting
mm,
me to when I might be hopping out of the car or pulling my mom's hair when I'm driving to try to get somebody to stick me with a needle might not be the best. Yeah.
yeah. Freya loves blood draws because, which is she doesn't love them, but she used to be really hard to get
Mhm.
blood from. She still is sometimes, but now I know more about hydration. But so I started getting her a treat afterwards. So, oops, sorry. But yeah, so she's like, anytime she gets a blood draw, which of course is at least twice a year, she's like,
Yeah.
all right, what's my treat? But
Let's go. I've set the precedent, yes. And some providers will do I know my own son provider, he does, like, virtual visits, and we very rarely go in person unless we, need to. for regulations, which is really nice because then
Mhm.
we don't have to leave the house. It's
Mhm.
just, hey, doctor so and so, how's it going? All right. Everything's good. Yep. Or if not, then we either come in person or talk it out over the virtual visit, which is a really nice option for a lot of
Yeah.
people.
Yeah, it really is. Yeah, we get to do every other one with her
Mhm.
endocrinologist, which is great because she's 5.5 hours away. So,
Oh, yeah.
well, I feel like we've covered everything on this list. Carrie, do you think?
I know we talked about kind of the signs for when is it maybe appropriate to start looking at a medication, but what are some of the signs that a behavior like a mental health crisis or a massive behavioral meltdown might be coming necessarily? I don't know if we had fully addressed it. If there's like any red flags or certain signals, certain signs that it's,
I think that's very individual.
yeah.
But, like, I thought we kind of touched on, like, if there's sudden changes.
Mhm.
For some people, sudden changes happen every day, meaning I know the triggers. I know what's gonna happen. But if baseline, I'm just cool as a cucumber, just I'm n nothing major's happening throughout the day, and all of the sudden, major things are happening behavior-wise. Maybe I'm starting to talk to myself or say I'm hearing things. Absolutely, that's a time to intervene. If I used to be really good with hygiene and now I'm not, or I used to do really good in school, and now I'm having so many behaviors at school. I mean, it might be time to look at school, but also talk to a
Mhm.
provider. Yeah. Changes
Okay.
in sleep sometimes too are a big indicator. Yeah.
Again, like I said, being in perimenopause and being more aware of estrogen or the lack of it on my body, I'm getting a new appreciation for what hormones do to us.
I
Mhm.
think same. I mean, obviously I'm in menopause, but I didn't realize how emotional, like I didn't get weepy and cry. I was angry like around that time. And I went, "Oh, that hormones are a powerful thing with emotions and regulation."
You really
Yeah,
are.
all important things with behavior.
Yep.
Yeah.
Yeah.
Mhm.
So it's
Yeah.
fun to have 2 girls, in their early teens during this time for me in
Yeah.
this
I
house.
bet.
Yeah.
It works out well. We're going camping for a couple of days.
I
Like,
love
we're
that you,
just
though, can, like, match their kind of hormonal energy and
well, it was funny because Lynn, you mentioned Target, and I was thinking about this a few years ago. I don't shop at Target anymore. If you know, you know. Freya started to have a meltdown in Target, and I was to the place, I was like, all right, let's do this. I'll sit here with you. Sit here and cry with you.
it's
Like she
fair.
wasn't
Yeah.
a big like she's not aggressive and violent, but she will get like she'll cry and she'll like get loud. But I was so down. I was like, fine, if we're let's do this. But then in a way that, like, kinda stopped her. She was like, "Wait, I don't want my mom to do that in public."
Oh,
She's like, "Oh god." So, anyway,
that's a new trick you found there, maybe, Annie.
"You can throw a
Oh, well,
fit, I'll throw one bigger."
Yeah, sometimes that's just the shift maybe that they need, like, What?" Pulls them out of that right away. "Oh, huh?"
Yeah, that is a
But
not
then
not a PWSA endorsed method, by the way.
but then there are times that you might be sitting in whatever parking lot or whatever store for hours and just waiting them because sometimes people have, like, these shutdowns and they just won't move. "Alright, well, I guess we're gonna be sitting here for the next 2 hours." Yeah,
Mhm.
yeah.
Yeah, that's in Freya's behavior report, shuts down
Mhm.
3
Mhm.
minutes to hours.
Yeah,
mm,
and there's really I don't know any magical way of pulling them out of that because 'cause they're gonna move when they wanna move and talk when they wanna talk. But maybe some communication tips maybe before we close, like, just that very clear, simple language, especially when somebody is acting out or having a behavioral crisis, if you will. They're not able to take in multi-step, like, directions. Even on a good day, that might be difficult. So if you're saying anything, 1 or 2 things at tops. You can validate without agreeing. to certain things and still maintaining some boundaries that you might need to as a parent or a provider too. But everybody's different, I think, too, with how the individuals with Prader-Willi syndrome, some people just want to be left alone. Other people want to be talked to. I've found with my own son, like rehashing things or explaining why this isn't a good idea immediately afterward is not the time.
Right.
That might reignite a behavior. It's when things are calm, let's talk about this. But always using in the moment, very simple direction.
Mm-hmm. And
If
kind of meeting
yeah.
them where they are. Like you said, you can say things like, I see how upset you are. I see that makes you really angry, or, without
Mm-hmm.
being like, you don't have a reason to be angry. You can
Right.
just acknowledge the feeling and then,
Yeah. Yeah. Because I think a lot of times they just want to feel heard and understood, despite how their bodies might be and their minds are making them act out, if
hmm
you will. Yeah.
yeah, I did a behavior workshop with Lisa Graziano years ago. And I remember she talked about like in that moment, they're getting loud because they're not feeling heard. And so if you can, hear them, the more you try and talk them out of it, like the more they feel unheard, the louder they're going to get. And so if you can recognize it, and of course that's not going to work every time, but it's a strategy, and it has worked for Freya. So
We all have our different strategies that
yeah,
might sometimes work, not 100% of the time. Yeah.
right, yeah. If
Yeah.
anybody tries the I'll have a bigger meltdown than you in public, let me know. Send me an email. All right. Well, Lynn, thank you so much. I really appreciate you and your willingness to answer these questions every week. Sometimes it's a lot.
We've gotten hundreds and hundreds of Ask Nurse Lynn
Yeah.
submissions at this point.
I didn't think that it would turn into what it has, and it's really helped me too to kind of get my groove on how to answer things, but also finding the resources. I don't know, I think when people look at first blush on, your Instagram or Facebook or whatever, you don't necessarily see all the links there. You have to go on the website or the blog
Yeah.
site to get those links. But there's a lot of good links too to things that you are in those responses. And I think that's been really helpful for me too, just to, well, there's a lot of stuff out there. If you
Yes.
do get a chance, go on there. There's often little helpful links to articles that you could share with your provider that they might not be aware of, or other tips or tricks
Yeah.
from other places. Yeah.
A
Yeah,
quick
that's a good
cheat to
plug.
that, yeah, is to go and just in our search bar on our website, type in like behavior, a specific
Hmm.
thing you want answers to. And all of our blogs, all of our resource documents, all of our web pages with that keyword in it will pop up. So you don't have to go and try to go through our hundreds of documents, all over our website because we have so many things. But
Yeah.
yeah, utilize that search bar. It is really, really helpful.
hmm
Yeah.
And definitely, if you're seeing the Ask Nurse Lynn's on Facebook or Instagram, you're reading most of the blog in graphic form, but definitely go to the actual blog for those links because there are so many
Yeah.
really good ones.
You're the best, Nurse Lynn. Thank you for listening to this episode of PWS United. If you want to learn more about Prader-Willi syndrome and how PWSA USA is making strides in advocacy, family support, and research, visit www.pwsausa.org. And while you're there, we encourage you to sign up for our Pulse email newsletter to stay informed about the latest news, resources, and events. Don't forget to subscribe to the PWS United podcast so you never miss an episode. Our team is always available to support families and their loved ones living with PWS 24 hours a day, 365 days a year. You can call us at 941-312-0400 or email info@pwsausa.org. Catch a new episode next Tuesday, and until then, have a great week.